Thyroid cancer is a disease in which malignant, cancerous, cells form from the cells of the thyroid gland. This is a common type of cancer that tends to develop with age, and is more common in women than in men. The thyroid is an important endocrine gland located in the anterior neck, in front of the trachea. It consists of two butterfly-shaped lobes and an isthmus connecting them. The thyroid absorbs iodine to synthesize and secrete thyroid hormones that participate in the body's basic metabolism, affecting the heart rate, organ function, etc. If the thyroid gland produces too much or too little hormone, it can lead to medical problems. These conditions are called hyperthyroidism and hypothyroidism, respectively. The number of people with thyroid cancer is increasing. There are two types of thyroid cancer: differentiated thyroid cancer, papillary, follicular, accounting for about 90%, and other types, medullary, indifferentiated about 10%. Differentiated thyroid cancer can be completely cured. Thyroid cancer is divided into two groups: differentiated thyroid cancer and anaplastic thyroid cancer. Differentiated thyroid cancer accounts for about 90%. This group progresses slowly, has a good prognosis, and includes papillary thyroid carcinoma, follicular thyroid carcinoma, combined papillary and follicular thyroid carcinoma. Indifferentiated thyroid cancer accounts for about 10%. This group progresses quickly and metastasizes quickly, including medullary thyroid carcinoma, anaplastic thyroid carcinoma. Early-stage thyroid cancer may not cause any signs or symptoms. Often the patient accidentally discovers it during an ultrasound health check or other medical examination. Only when the tumor grows larger, can be seen or felt, the patient goes to the doctor. In addition, when the tumor is large and invasive, it can show symptoms such as shortness of breath, difficulty or pain when swallowing, hoarseness or change in voice, unexplained weight loss, tired, painless swelling in the front of the neck. The cause of thyroid cancer is often unknown. However, a combination of genetic conditions and risk factors may increase the likelihood of developing the condition. Certain risk factors in certain regions cause more cases of thyroid cancer in some countries than others. Objective causes may include iodine levels are too high or too low, exposure to ionizing radiation. Other causes may include age. The older you are, the higher your risk of developing thyroid cancer. Overweight, obesity. Overweight people are more likely to develop thyroid cancer than normal people. In addition, the following risk factors also contribute to thyroid cancer, including female. Thyroid cancer occurs more often in women than in men, at a ratio of approximately 3:1. Asian. People regularly exposed to radiation. Family history of thyroid cancer, goiter, or other thyroid disease. Some genetic conditions, such as medullary thyroid cancer. Women, more susceptible to thyroid cancer than men. The age of onset is from 25 to 65 years old. Age and gender factors also greatly determine whether a person will get thyroid cancer or not. Specifically, the risk of thyroid cancer may increase as people age. However, it also occurs more frequently at younger ages. Asian. People who are regularly exposed to any type of radiation. Family history of thyroid cancer, goiter, or other thyroid disease. Some genetic conditions, such as medullary thyroid cancer. Thyroid cancer can cause complications by compressing and/or invading surrounding tissues. It can also metastasize to the lungs and bones. In addition, Surgical treatment of thyroid cancer can also cause complications. This is partly because the anatomy of the neck can change. Possible complications include hypothyroidism, dysphagia due to superior laryngeal nerve damage, vocal cord paralysis due to recurrent laryngeal nerve injury, hypoparathyroidism due to parathyroidectomy. Using radioactive drugs can have the following consequences: radiation thyroiditis and transient thyrotoxicosis in patients undergoing simple lobectomy, nausea, vomiting, loss of appetite and headache, uncommon, pulmonary fibrosis in patients with large lung metastasis, cerebral edema in patients with brain metastasis. Affects fertility, transient hypoplasia or menstrual irregularities, slightly increased risk of leukemia or breast and bladder carcinoma. The most serious complication is metastasis and death. The most common sites of metastasis are the lungs and bones, followed by the brain and liver. The tumor can also metastasize to other sites in the body. The doctor can examine the neck area, thyroid, neck lymph nodes, and ask about the patient's and family's medical history. The doctor will order diagnostic tests including thyroid and neck lymph node ultrasound, detect, evaluate location, size, nature, and quantity of thyroid tumors and neck lymph nodes. Ultrasound-guided cytology of thyroid tumors and neck lymph nodes, fine needle aspiration, FNA. A needle is inserted through the skin into the thyroid gland to collect some cells from the tumor or neck lymph nodes. The doctor will examine the cells under a microscope to look for cancer cells. CT and MRI of the neck, to further assess the extent of invasion of thyroid tumors and lymph nodes to surrounding organs such as soft tissues of the neck, trachea, and esophagus. Immediate intraoperative biopsy. The doctor will remove the thyroid nodule or a lobe of the thyroid gland during surgery, and perform histopathological testing during surgery to provide timely and appropriate treatment. Biological markers. With differentiated thyroid cancer after surgery, the TG index will be used to evaluate treatment and monitor recurrence. With medullary thyroid cancer, the calcitonin and C indexes play a role in prognosis and monitoring after treatment. There are many different treatment options for differentiated and indifferentiated thyroid cancer. How appropriate each treatment is will depend on the stage and type of thyroid cancer of the patient. Differentiated thyroid cancer is the most common with a rate of about 90% and can be completely cured. Treatments for thyroid cancer include surgery, radioactive iodine therapy, I-131, targeted therapy, tyrosine kinase inhibitors, TKI, and hormone therapy. Treatments will depend on the stage of the disease and histological type. The choice of surgery to remove only one lobe of the thyroid gland or to completely remove the thyroid gland and dissect the neck depends on the stage of the disease assessed before deciding on treatment. Dr. Hai Bin said that at Tam An General Hospital, thyroid lobe surgery with tumors in early stages, preserving one side of the thyroid lobe, brings a better quality of life to the patient. For patients with larger tumors, with metastasis to the neck lymph nodes, surgery is performed to remove the entire thyroid gland, dissect the neck lymph nodes, and then consider whether an additional dose of radioactive iodine 131 is needed. After thyroidectomy, the patient will no longer have thyroid hormones, so the doctor will prescribe thyroid hormones to compensate for the rest of their life. Radioactive iodine 131I therapy plays an important role in the treatment and control of thyroid cancer. It is combined with thyroidectomy to eliminate cancer cells remaining after surgery. Radioactive iodine will be absorbed by thyroid cancer cells and emit beta radiation to destroy them. Tyrosine kinase inhibitors target tyrosine kinase signaling pathways, including the RET, RAF, or ROS protein kinase genes, to help control disease progression. Drugs used to treat advanced and metastatic differentiated thyroid cancer include sorafenib, lenvatinib. After a complete thyroidectomy, The patient will be prescribed lifelong thyroid hormone replacement medication by the doctor. In addition to supplementing the body with thyroid hormone medication also has the effect of inhibiting the recurrence of thyroid cancer cells. To reduce the risk of thyroid cancer, people should limit exposure to risk factors such as radiation, iodine deficiency or excess diet, should eat and live a healthy lifestyle and practice the habit of regular health checkups every 6 months or at least once a year to detect abnormalities early. Ideally, people in their 40s and those with risk factors should be screened for thyroid cancer.